Good evening, guys. I have your B for you. We're discussing digital tools can improve dementia care. Okay, so here we go with the presentation I made for you. Please enjoy. The headline: Digital tools can improve dementia care for people with dementia, aging in place, and their caregivers. Reflects a growing recognition that technology is not just an accessory in healthcare. It is becoming a critical infrastructure for sustaining independence and easing caregiver strain. The surrounding article situates this within the broader movement toward aging in place, where people with dementia remain in their homes rather than moving into institutional care. Digital interventions, ranging from simple reminder apps to sophisticated telehealth platforms, are highlighted as practical evidence-based supports that can bridge gaps in care, reduce isolation, and empower caregivers. The findings from the page. The article draws on a scoping review of 27 studies, synthesizing evidence across multiple forms of technology. The findings underscore several consistent benefits. Caregiver empowerment. Digital tools increase caregivers' confidence in managing daily challenges, from medication schedules to behavioral changes. Emotional well-being. Both caregivers and people with dementia report reduced stress, anxiety, and feelings of hopelessness when supported by technology. Social connectedness. Platforms designed for communication help counteract isolation, enabling meaningful interaction with family, friends, and peer networks. Care coordination. Shared digital systems streamline collaboration. Among family members, clinicians, and community services, reducing fragmentation in care. How digital tools help in practice. The article illustrates several practical applications. Remote monitoring and alerts. Smart sensors track movement, sleep, or medication adherence, sending notifications to caregivers when risks arise. This reduces the need for consistent in-person supervision. Telehealth and virtual visits. Video consultation allow for timely medical advice without the logistical burden of travel, especially valuable in rural areas or underserved areas. Cognitive and daily living aids. Apps provide reminders, structured routines, or simplified interfaces that help people with dementia maintain independence and reduce confusion. Okay, social connection platforms, tailored video call systems, and moderated online groups foster engagement while caregivers gain access to peer support communities. Care coordination platforms, shared calendars, task lists, and secure messaging systems ensure that family members and healthcare providers remain aligned. Limitations and cautions highlighted by the page. The article also acknowledges challenges that temper the optimism. Digital divide. Unequal access to devices, internet, and digital literacy risks leaving vulnerable families behind. Usability challenges. Tools must be intuitive and adaptable to different stages of dementia, or they risk becoming burdensome. Training and support needs. Caregivers often require guidance to set up, interpret, and integrate technology into daily routines. Privacy and consent. Monitoring technologies arise ethical questions about autonomy, dignity, and data security. Evidence gaps. While short-term benefits are clear, long-term outcomes, sustainability, and cost-effectiveness remain under-researched. Practical takeaways for caregivers and programs. The surrounding content emphasizes actionable strategies. Select sample targeted tools that access specific needs, such as medication reminders or fall detection, pair technology with human support and training, ensuring it complements rather than replaces caregiving relationships, advocate for equitable access, including funding for devices, internet connectivity, and caregiver education, embed tools within community-based networks where technology enhances, not isolates, social and medical support systems. Bottom line, the article's central message is that digital tools, when thoughtfully designed and equitably implemented, can transform dementia care. They enable people with dementia to remain home longer, sustain independence, and reduce caregiver burden. Yet technology alone is not enough. Access depends on usability, training, privacy, protections, and equitable access. Ultimately, digital innovation is, is most powerful when it strengthens human connection and integrates seamless into community-based care. Okay, guys, I'm going to take a little break and I'll be back on with C for y'all. For now, Gator Wellness, take care, folks. I'll be back on with C shortly. Give me a bit, please, for a break. I'll be right with you.